A 45-year-old male presents with crushing chest pain, shortness of breath, and diaphoresis. His ECG shows ST segment elevation in leads 2, 3, and of. What is the most appropriate initial intervention? A. Administer nitroglycerin. B. Perform an echocardiogram. C. Administer aspirin. D. Start 4 antibiotics. Answer: C. Administer aspirin. Explanation: this patient presents with symptoms suggestive of an acute myocardial infarction, ME. Aspirin should be administered promptly as it helps reduce platelet aggregation and can improve outcomes in ME patients. A 25-year-old female presents with a high fever, sore throat, and swollen cervical lymph nodes. On examination, you note tonsillar exudates. What is the most likely causative organism? A. Streptococcus pneumoniae. B. Staphylococcus aureus. C. Group A Streptococcus, Streptococcus pyogenes. D. Haemophilus influenza. Answer: C. Group A Streptococcus, Streptococcus pyogenes. Explanation: the symptoms described are indicative of acute pharyngitis, commonly caused by Group A Streptococcus, Streptococcus pyogenes. A 30-year-old male presents with a sudden onset of severe headache, vomiting, and photophobia. On examination, neck stiffness is noted. What is the most likely diagnosis? A. Migraine. B. Cluster headache. C. Subarachnoid hemorrhage. D. Tension headache. Answer: C. Subarachnoid hemorrhage. Explanation: the classic presentation of subarachnoid hemorrhage includes a severe headache, often described as the worst headache of my life, along with neck stiffness and other signs of meningeal irritation. A 55-year-old male presents with painless, gross hematuria. He has a history of smoking. Which condition should be considered first in the differential diagnosis? A. Urinary tract infection, UTI. B. Bladder cancer. C. Benign prostatic hyperplasia, BPH. D. Renal calculi. Answer: B. Bladder cancer. Explanation: painless gross hematuria in a patient with a history of smoking is highly concerning for bladder cancer and should be thoroughly evaluated. Scenario 5. A 60-year-old female with type 2 diabetes presents with polyuria, polydipsia, and unintentional weight loss. Her fasting blood glucose is consistently elevated. What is the most likely diagnosis? A. Type 1 diabetes. B. Diabetic ketoacidosis, DKA. C. Type 2 diabetes. D. Hyperosmolar hyperglycemic state, HHS. Answer: C. Type 2 diabetes. Explanation: this patient's age, type 2 diabetes risk factors, and the absence of DKA or HHS suggest a diagnosis of type 2 diabetes. A 35-year-old male presents with sudden onset right lower quadrant abdominal pain. On examination, there is localized tenderness and guarding. What is the most likely diagnosis? A. Appendicitis. B. Diverticulitis. C. Cholecystitis. D. Pancreatitis. Answer: A. Appendicitis. Explanation: sudden onset right lower quadrant abdominal pain with localized tenderness and guarding is highly suggestive of acute appendicitis. A 28-year-old female presents with a painful, swollen, red joint in her right knee. She has a history of rheumatoid arthritis. What is the most likely diagnosis? A. Septic arthritis. B. Gout. C. Osteoarthritis. D. Psoriatic arthritis. Answer: A. Septic arthritis. Explanation: in a patient with a history of rheumatoid arthritis, an acutely painful, swollen, and red joint should raise suspicion for septic arthritis, which is a medical emergency. A 50-year-old male presents with progressive shortness of breath, wheezing, and a chronic productive cough. He has a history of smoking. What is the most likely diagnosis? A. Chronic obstructive pulmonary disease, COPD. B. Asthma. C. Bronchitis. D. Lung cancer. Answer: A. Chronic obstructive pulmonary disease, COPD. Explanation: progressive shortness of breath, wheezing, and chronic cough in a patient with a history of smoking are suggestive of COPD. A 70-year-old female presents with confusion, fever, and a stiff neck. Her family reports that she recently recovered from a urinary tract infection. What is the most likely diagnosis? A. Meningitis. B. Alzheimer's disease. C. Delirium. D. Urinary tract infection, UTI. Answer: A. Meningitis. Explanation: the combination of confusion, fever, and a stiff neck suggests possible meningitis, especially in the elderly. A recent UTI history may indicate an underlying source of infection. A 45-year-old male presents with right upper quadrant abdominal pain that radiates to the back. On examination, you note jaundice and dark urine. What is the most likely diagnosis? A. Acute pancreatitis. B. Cholecystitis. C. Acute hepatitis. D. Duodenal ulcer. Answer: C. Acute hepatitis. Explanation: right upper quadrant abdominal pain, jaundice, and dark urine are suggestive of acute hepatitis, which can have various causes, including viral infections.